So today we'll be discussing about distraction osteogenesis, and distraction osteogenesis has a very kind of a amalgamated role in maxillofacial surgery as well as orthopedics. And sir will tell us now about the indications which are required in orthopedics.
Like in orthopedic cases, we can use in this case of deformities like knock knees, or we can use in this bone defect, any injuries of the long bones. Like we can also use this in limb lengthening, increase the length of the bone like tibia and femur, and it has a multiple role. It can also be used in other specialties like maxillofacial. So in this case we will discuss.
So exactly, sir, like we just said, ki in maxillofacial surgery also for certain jaw deformities, for post-traumatic deformities, we need to kind of do it, and in case of for lengthening the bone. So in that case, we use distraction osteogenesis. Also, where we cannot use the conventional orthognathic surgery because the length we cannot extend beyond a limit in orthognathic. So that's when we use distraction. So would you also enumerate about the stages and the phases of DO, sir?
So like the various stages in this case, first we will do osteotomy, that is the cut down the bone and then placement of the device, and then there is some latent period. After this we will activate the device, so we'll lengthening step by step like 1 mm per day, and gradually we will increase the length. And the end there is some consolidation phase in which we prepare the bone to mature and to achieve its normal structure. And there are various advantages of this osteogenesis and distraction osteogenesis, like is no bone graft is needed, no extra bone is needed. In this case, bone of the patient's bone is used to lengthen the bone.
Exactly, the bone's in own healing property, the body's own healing property is used for lengthening of the bone. And so along with this, a very small point on distraction histogenesis as well, that along with osteogenesis, the soft tissues would also adapt and would lengthen. So that's a concept which is known as distraction histogenesis.
So this is all about the distraction osteogenesis, can be used in various specialties including orthopedics and maxillofacial surgeries also.